The Ream run shoulder replacement for shoulder arthritis. In a healthy shoulder, there's a ball and socket joint. Both sides of this joint are covered with a layer of cartilage, which allows for smooth and unrestricted motion. The ball, also known as the humeral head, is found on top of the arm bone, known as the humerus. The socket, also known as the glenoid, is part of the shoulder bone, also known as the scapula. In a shoulder with arthritis, the cartilage on both the ball and the socket are worn, thin, or completely absent. Without cartilage, there is bone-on-bone grinding when the shoulder is moved. There are often bone spurs seen on the bottom part of the ball, as well as behind it, in front of it, and sometimes even on top of it. These bone spurs often restrict motion of the shoulder. When treating shoulder arthritis surgically, we often start with the arm bone. We make a cut at the base of the ball, and then we remove any offending bone spurs which may restrict motion. This initial preparation of the arm bone allows us access to the socket. Here we can ream out the socket so that it has a proper concavity. We then use a special jig to machine out the socket. This allows us to insert a new artificial socket. This component is reasonably durable and covers and protects the reamed out socket. After insertion of the artificial socket, we prepare the arm bone for the main shoulder implant. A humeral component is pressed into the humeral canal. The top of this implant is properly sized to replicate the ball surface the patient once had. It is made from a special stainless steel which is extremely smooth and polished and sized to match the artificial socket. The stem of the humeral component is made from a special titanium which bone loves to grab onto. The previous bone-on-bone shoulder joint has been replaced with a polished metal ball on a plastic socket. This should allow for much smoother motion with less restrictions and greater comfort. This is a total shoulder replacement. The weak link of a total shoulder is the artificial socket. This component is made out of a plastic. High-density cross-linked polyethylene is pretty durable, but was not designed for heavy loading or repeated impact forces. And as most patients who get a total shoulder are not considering activities which may threaten a total shoulder, it is generally not an issue. But for younger patients and patients who heavily use or abuse their shoulders, they can expect a shortened lifespan of their plastic component. For these type of patients, which include farmers, weightlifters, professional level athletes, and laborers, we often perform a different type of shoulder replacement for them. We do all the same work on the arm side where we insert a metal stem with a smooth metal ball. But on the socket side, we ream out the socket so that it has a proper concavity, but do not insert the plastic component. This procedure is called the Ream run. The advantage of this procedure is that there is no plastic to wear out, loosen, or otherwise fail. Patients can return to heavy lifting, loading, and impact activities. The disadvantage of this procedure is that there's no plastic covering the raw socket. Patients should expect recovery to take longer and be more painful than a total shoulder. If your main goal is for maximum comfort early on after a shoulder replacement, you should consider a total shoulder replacement. If your main goal is to be able to push bales of hay, chop wood, or to perform similarly heavy activities, then you should consider a Ream run.